Deep in the heart of the Surrey countryside lies an extraordinary vet's practice.
Right, straight into number one. Good. All right, crack on. We're going to theatre. Let's go. All hands on deck.
Here, the hardest to treat pets from across Britain
Oh, ow, 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 ow.
are given some of the most advanced procedures available anywhere in the country.
I got it. Various pieces fit together to build a new endoskeleton, a bit like the Terminator.
The practice is the brainchild of one man, Professor Noel Fitzpatrick.
Very fashionable, Cookie. That is beautiful.
Yes, yes!
Known as the Bionic Vet, Noel has invented countless operations to help heal sick animals.
Some people come and they expect you to work a miracle,
Try and make it work.
but most people come full of hope. Come on, able to walk within 48 hours.
The team here just go all gooey when a puppy comes in.
I love puppies. Are you still cuddling that puppy? Well, if you need to get on and you want somebody else to cuddle.
They just want to play.
Don't do that. You just had surgery, remember? Oh, thank you.
They're like rough and tumble with their litter mates, biting their ears, biting their paws.
I am probably the worst person for obedience because I always feel so bad that I have to like give them tablets and give them injections, and I'm the scary nurse coming along with the needle. So I'm like, oh, you're barking at me, here, have a treat.
It's early on Friday morning. Alternay and her 11-year-old daughter, Nicole, have brought in their Staffordshire Bull Terrier, Rex. He's just 4.5 months old. Over the past few weeks, Alternay has noticed a problem with his right elbow, and he's been reluctant to walk.
Oh, he loves her.
You are a little wriggle bum. I got you. I got you. Now what do you do?
Oh, he's in heaven.
Nicole wanted a puppy for years. Her mum promised her that if she passed her exams, she could finally get one.
I give her idea if she passes 11 plus, she can have a puppy. She didn't pass 11 plus, we get puppy anyway.
Because I'm the only child in my family, I thought if I have a pet, like a dog, then I won't be lonely anymore and like I have a little brother.
Rex's local vet has sent over x-rays.
So we're about to see a little dog called, oh shit. I didn't know that. That's not good.
Thank you.
Hi, hello, how are you? Please come in. Grab a seat right there. What's your first name?
Nicole.
Nicole, and?
Alternay.
That's a beautiful name. Hey mate, how are you, buddy?
So worried.
Hi, buddy. It's a pretty prominent deformity, isn't it? I mean, it's pretty obvious on the x-rays.
Rex's elbow joint has been deformed since birth, and it's causing his leg to collapse under him.
Nicole, he has 3 bones in his arm. His humerus is fine. His ulna is okay. It's not normal, but it's okay. His radius is not okay. It's popped out of the joint. That should be in there.
Is it possible?
There's only 2 ways to do it. One is pop it straight back in, which usually doesn't work. The second way is to pull it gradually in. You would end up with 2 wires like that, with 2 bumps, holding that head and pulling it gradually that way over about 3 weeks. Can you just pop him down so I can see him walk? Good boy. Good boy. Yeah, he's quite lame, isn't he? All right, big guy. Now, clap your hands and get him to go towards you.
Come here.
He's well trained. I guess the first question to ask you is, are you prepared to go through this? Because it may be a journey which could last 4 months, 5 months.
We're gonna go for this, yeah? Yeah, definitely.
He's going to be staying with me for 3 weeks. I have to monitor it, which I'm sorry about. Big cuddles for Mum and big cuddles for Junior Mum. Is he your first puppy? I'm sorry. Okay, there we go.
I was really worried about him, and I'm gonna really miss him at home.
Rex is sent for CT scans and X-rays so Noel can assess just how bad his elbow problem is.
Thanks very much. Cheers. Come on, little Rex.
I've got those pictures. CT for Rex Lyons. The head of the radius is completely out of the joint right there. So that pedestal should be there. Okay, well, we know what we gotta do.
Animals of all shapes and sizes come through the doors of Fitzpatrick referrals.
I've never seen anything quite like it.
Although dogs are the most regular patients, the practice sees around 150 cats every month. Barbara has travelled from Somerset with Amy, a rescued stray black cat.
Are you just checking in? Yes.
Amy was discovered lost in her neighbour's garden with a suspected broken leg. Barbara runs a cattery in Somerset. As well as 6 cats of her own, she has up to 49 feline guests to stay each night.
Hello, you lot. How you doing? You all right? Hello, Jack. It's always been my dream to have my own boarding cattery. So I worked as a volunteer in a cat rescue shelter for about 22 years. I just love cats. I love all animals, but just particularly cats. Morning, Isis. Think you're a good morning cuddle. Oh, it's just amazing. I love it. Just being surrounded by cats every day. It's my idea of a dream. But you're adorable, aren't you? I try and look on it as a home from home because I always say to people, I treat your cats the same way as I treat mine, and my lot are spoilt rotten. And I think people like that. They call me the mad cat woman, which I look on as a nice thing. Hey.
Of all the cats Barbara takes care of, one type in particular holds a special place in her heart.
It's black cats really with me because you always found that people didn't want the black ones or the black and white. They were always the ones that were sort of left at the end of the year. And I just loved black cats.
Barbara couldn't resist taking Amy in when she found her with her injured leg.
I just, can't sort of turn away anything in need, especially if it's a little cat.
Amy, please.
Barbara is seeing Miguel, one of the practice's senior surgeons.
So please come in and have a seat.
Due to the complexity of the fracture, Amy was referred here by her local vet.
They thought that the break was about 3 or 4 weeks old.
Okay.
And it had actually started to mend.
The bone wasn't in the right position when she tried to heal it, and obviously it's bent. You see how happy she is to fully flex. No problems here. Here she's not so happy. Okay, I'm sorry. It's okay. I would definitely recommend to do surgery on her because I think that we can make her much better. What we're gonna have to do is to probably fracture it again.
Yeah.
Okay? I think there is some challenges, but definitely I think we can do it. Okay?
That's what I was hoping. Right, bye-bye, darling. Be a brave girl.
Ah, yes.
You come home all fixed.
Yeah, she should come very straight back home, eh?
Oh, lovely. Thanks ever so much.
Take care.
Miguel wants to admit Amy for more detailed scans before operating on her tomorrow.
Oh, all a bit twitchy at the moment. It all went very quickly. I was expecting just to come today, like for the referral, but she's going to be done tomorrow. Probably have a large rum to steady my nerves tonight.
It's 9 p.m. 4.5-month-old Rex, the Staffy puppy, is being prepared for surgery on his elbow.
Okay, so for this battle, we need some heavy artillery.
Noel has designed a frame which will gradually pull the top of the bone back into the elbow joint.
Alrighty, here we go. So the first thing we do is expose the head of the radius. Okay, so I'm going to drive some wires in. As they go through, the stopper locks and they can't go anymore. So this is the absolutely critical part of the procedure. You got to get this right.
The angle of the wires demands pinpoint accuracy, or the bone could be pulled into the wrong position. Noel cuts a slope along the radius for the top part of the bone to slide down.
This kit's amazingly versatile. It allows you to build a three-dimensional scaffolding in any position on the leg. So the principle of this frame is that there's two wires down here which are attached to the head of the radius. The dice gets turned 1, 2, 3, 4. And what happens there is that the radial head gets pulled 1 millimeter down that slope. Okay, Rexy, are you under there? There you are. Let's hope it looks okay on the x-rays. All right, let's go.
The operation has taken 2 hours. Noel calls Alternay and Nicole to update them.
We can't get too excited yet, Nicole, because it's early days, but the surgery bit went fine. So now it depends on how lucky we are with pushing the head back in and stretching the ligaments back to where they should be.
Well, thank you very much. Thank you.
Okay.
Nicole, not letting us know.
You all right, Nicole? Yeah?
Yeah.
Good girl. He's doing fine. He's getting lots of cuddles. And the girls are looking after him well. You take care, get some sleep.
Thank you.
Thank you. Good night. Bye-bye. Bye. All ages affected by love.
It's early afternoon. Amy, the rescue stray cat, is having x-rays ahead of surgery on her leg.
Potential risks of what we are doing.
But Miguel has spotted a problem.
In here, we actually have something that looks worse.
Where the fracture has healed, it has left the bone badly deformed, making surgery more complex and far riskier. Miguel needs to consult with Noel.
Amy is not a usual case. It required a lot of correction, and it was definitely a case to have a chat with Noel.
Every surgeon here is highly skilled and hugely compassionate, otherwise they would not be here. But we work as a team. So when Miguel will come and ask me something, it's really good. And it's good for us to get the best result for the patient.
Noel will perform Amy's surgery while Miguel assists.
Ultimately, the objective is to get the wrist and the elbow into a straight line, so Amy can walk with as normal a leg as possible. That's the plan. Got the double whammy here of severe deformity plus fragile bone, which is a little bit like China.
Noel carefully cuts the bone, enabling him to reposition the wrist. He rotates the paw back and fixes it using a plate and screws.
So we put in the initial screws, and now you can see that the foot is back in alignment with the elbow. Okay, stitch up, close the skin, put clamps on, job done. Thanks.
As the plate is so thin, Miguel puts a frame on the forearm to give it more support until the cut in the bone heals.
That's perfectly straight.
Yeah, it looks amazing.
Good idea to leave the gap there because there would be a lot of foot swelling, but big blood supply issue and potential nerve issue because of the amount we've had to rotate. This is going to require at least a week of massage, and in my experience, if that doesn't happen, if we don't massage that, Amy could lose her leg.
There are over 200 staff at the practice, providing 24-hour care. With up to 57 pets in residence at any time, there's a lot of looking after to do.
Good boy. Good girl.
It's 9 p.m. It's been 2 weeks since 5-month-old Staffy Rex had surgery.
Good boy.
Louise has brought him down for x-rays.
Oh, I love him. Oh God, he's so cute. His foot is in your pocket. Have you got your foot in Louise's pockets? Shall we give you a bit of legs?
The x-rays will show if the frame is pulling the bone back into his elbow joint.
Are you the cutest boy ever, Rex? Look at him. He knows I'm talking about him.
The tightening of the frame has done its job, but Noel has noticed there is another issue.
The problem is that with the radius back in position in the joint, it's very obvious now that the wrist is facing outwards.
Rex will need further surgery. Noel updates Alternate.
Hello.
Hey, it's Noel. How are you?
Fine, thank you. How are you?
I'm very good, thanks very much. It's obvious now that the radial head is back in position, that the wrist is turned outwards.
What are we going to do now?
Well, we're going to ultimately have to cut the radius again further down and straighten the leg.
Is it going to be longer now? Not 2 weeks. It's going to be...
I think now that he's settled in, it's better for him if we just crack on and get it done.
Yes, of course, yeah.
Without surgery, Rex's forearm would continue to deform and could cause further pain.
If we leave it like that, the foot is going to end up like a flipper facing outwards. We've got to cut the bone and straighten it. Okay, let's drive some pins.
The next part of the frame will hold the rotated paw so it is straight in line with the elbow.
Slowly we're twisting the wrist around now. In a moment it will be straight.
Noel will also secure the cut slope on the radius in its new position.
The main thing is that now the elbow and the wrist are moving in a straight line, so that's fine.
The frame will stay on for 3 more weeks to ensure the bone heals.
All right, let's get a photograph, let's get out of here.
Rex's leg is now held together with a combination of metal pins and bolts.
I can only see metal.
Basically, it's just white. It's a white out. Man, what a Meccano set.
It's early morning. Heather and Amy have brought in their Staffy Labrador cross, Piggy.
All the treats. Piggy.
When I was about 16, I worked at a dog boarding kennel, and they also had rescues there. So the clause of me taking this job was, you can work there, it's not a problem, but we are not getting a dog. I think that lasted 3 days.
Well, I remember the words. It was, Mum, there's this dog that nobody wants. Oh, here we go. Yeah, very nice. Well, I'm sure there's a lot like that, but we're not having one.
Dad didn't want a dog. And from the off, if you get this dog, it's your dog. Okay, I'm just telling you now. She kind of forced herself upon him.
That was about 10 years ago, and you wouldn't be without her now,
No, I wouldn't. No, she's our baby. Do you want me to give her a treat or not? No, maybe not. No, we'll wait.
She snorts like a pig.
She does.
She eats like a pig.
Piggy. She's not blessed with the best looking face. I always say to people, she's got the face only a mother could love.
After 3 years of pain management for her knees and back, Amy and Heather want to find out if surgery could improve her quality of life.
Come on, Piggy, good girl.
We have got some treats because she can be difficult.
Hi there.
Hello.
Ah, don't you look lovely today? Look at that dress. How are you? Lovely to see you.
Amy.
Hello, Amy. Amy and Heather. Look at you with your nice kerchief on. The curious thing about your history is it's been going on for so long. So tell me about that. Tell me about when you first noticed anything.
I noticed at first that her ankle seemed to be clicking into place when she put weight on it. So rather than being a fluid movement, it sort of clicks down at the back.
So at that time, was that in your head? Oh, no eating. No, don't let her eat that. Don't let her eat it. She's not allowed to eat because I might have to knock her out.
She's not called Pig for nothing. It's funny how she can't walk, but she can
Yeah,
find
she
a
can
treat.
certainly eat, can't she?
We were going to mention about she has, don't know if it's related, she's never really wagged her tail. And it's a little bit crooked. She always holds it to that side.
Yeah, she does have a crooked tail.
I don't know if it's related to that, but yeah, she
Okay.
doesn't wag it or anything.
First of all, we got to figure out what's wrong. And secondly, we got to figure out what's in her best interest. All right, well, first things first, I need to see her walk. So I need to see what you're seeing. Let's go outside. No treats. Let's go over here where there's no traffic. So this way is best for me.
Come on, Piggy.
Slowly. Let me see what you're seeing. Keep going. I can hear the nails scuffing.
Yeah.
Okay, great, thank you.
Good girl, Piggy. Come on. Good girl, Piggy.
Keep comforting her, please, guys.
Good girl, Piggy.
All right.
I'm sorry, sweetheart. It's got to be done. I'll try and make it as quick as I can.
Good girl, Pig.
All right.
All right, let go. Everybody up, back away. Let's get that muzzle off. Thanks.
Good girl, Pig.
I strongly suspect that she has some bulging discs in her spine. And also, she does have arthritis, I would say fairly bad, in the right knee. And maybe also in the left knee. I'm sorry, I know it's upsetting for you, but what can I do? I mean, obviously I gotta tell you as it is.
That's why we're here.
Otherwise there's no point, is there? I mean, there's no point in me dressing it up. It is what it is. If her heart is fine, given her age, she should go on for another maybe 5 years, you know, who knows? You don't know. She could do. So we're gonna need to get an MRI of her spine and some x-rays of her knees and then decide. So big kisses.
Good girl, Piggy.
Off you go.
Good girl, Piggy.
There we go.
That's a good
Well done.
girl.
Good.
Before they can make any decisions about Piggy's future, Noel needs to find out how serious her condition is.
We didn't realise that it was quite that severe, and I think part of that is because of her breed. They don't show pain. They're very tough animals, which is not really an advantage in this situation. I wish she could just tell us. Who'd have dogs?
It's your fault.
It's midnight at the practice, and 2 days since rescue cat Amy had surgery on her leg.
All right, sweetie. There we go.
During a routine check, Noel has noticed something is wrong.
We found that there's a very big problem with the blood supply to the foot. And that's a massive, massive issue for us. Okay, thank you. The operation has worked well in terms of straightening the bone, but the blood vessels have shut down. The blood that's going into the paw is not coming back again. So the foot is cold because it's got cold blood in it.
Noel has come up with an unusual solution: live leeches.
I grew up in farm animal practice, so I am always of the opinion that old-fashioned methods are actually the best until proven otherwise.
Barbara has agreed for medical-grade leeches to be brought down to the practice by express courier from Wales. Noel hopes the leeches will suck the cold blood out of Amy's leg and get the circulation going again.
I hate it when I have to say the word leech, because it always means trouble. Potential limb loss, trouble.
The leech treatment freaked me out. I couldn't cope with it. I took in the delivery and I was like, I couldn't even hold the box. I don't like little things like that.
Come here, bud. Detach. There you go. Oh, slippery sucker.
When the pot came over, it was quite disgusting. I couldn't believe it.
Actually, we use leeches remarkably uncommonly. Once a year, maybe?
Obviously, I think you can't expect anything in this place.
Oi, don't stick to me, you little blighter. Get on there, suck that. Suck it. We use one at a time to see whether the foot is alive, because if the leech falls off straight away, then it's very bad news. Good, Amy, well done. Come on, mate, get in there and see what you can do. We want to see them now getting gorged with blood.
Barbara speaking.
Hey, Barbara, it's Noel.
Hi, Noel. How you doing?
Well, it's a tough night. I called the leech people.
Yeah.
4 are now sucking on the foot.
Oh, bless.
They don't hurt. She's lying there quite peacefully, having her head stroked.
Oh.
It could be that the blood vessels were already tethered or stuck down at the back of the bone that we rotated. We would never see that because it's at the back. The fact that they have stuck to the foot is mildly encouraging.
Good.
If they had not stuck to the foot, then the foot is dead.
My starting point for this was to try and improve her quality of life, knowing that she's so young.
I mean, I think you did the right thing for her to try and save the leg.
Yeah.
But we're going to know in the next few days if it's realistic to try and keep going.
The leeches have been attached to Amy's paw for 25 minutes, and it's good news.
Look at how big they are now. Wow, look at that. They've completely gorged now, which is great. That's exactly what I want to see. There's nothing nicer than a big fat leech when you're in this bad situation. What are you laughing about? It's true. I could see nothing better than that right now. That's what I'm hoping for. All right, buddy, thank you very much for doing that. I appreciate it. It's one thing to have a swollen foot. It's another thing entirely to have a swollen, cold foot. If the foot's cold and you do not act, you're going to lose a leg. This is a huge lesson for you guys. Huge.
You know, kiss. Did she waggle? Oh. Oh. That's so cute.
Rex, the 6-month-old Staffy puppy, has been an inpatient at the practice for 6 weeks.
Oh my gosh. Come on, you're gonna have to clean that one up. You made him spray it everywhere. You held him up like, woo-hoo! Oh, Rexy, Rexy, Rexy.
The bone in his leg has healed well enough for the frame to be reduced in size. But he still needs daily rehabilitation to rebuild the ligaments supporting his elbow. Alternay and Nicole have come in to visit him.
We're looking forward to him coming back home because then we could have some life in the house and it won't be as boring as it is now.
They've missed him so much, they've even considered expanding their family.
We were thinking about another puppy.
Now, hi, how are you? Now, do you want to sit down there and I'll pop him on your knee? There we go. Okay, big Rex. All right, big Rex. He's getting bigger and bigger all the time, isn't he? There we go, Rex, good boy.
Look, he's so strong now. I can't hold him.
Clearly is very excited about your visit, aren't you, Rexy?
Oh my God.
My colleague Morris is here and he's going to show you how to do the walking so that you can go for a little walk outside.
You can go for a walk now. Easy, easy,
fly.
easy, easy. You have so much energy. I forget how energetic you are. Monster.
He needs calm, regular walking to strengthen ligaments in his elbow.
Yep, yep, yep.
But Rex has other ideas.
Rex, sit down, sit down.
This is it, 2 adults completely overtaken. Here we go. Yeah, so we get him distracted with the lead, that's fine.
Well done, Rex. Good boy. Oh, I'm so happy to see him walking. I'm going to take you home soon. Okay? Good boy.
All right, you take
Thank
care.
you.
Okay.
Thank you. Bye.
Bye.
Rex will stay at the practice for another month for rehabilitation.
So do you still think to have another puppy? Yeah, I think we have our hands full with this one.
Oh, God. Did you answer the phone and say meow?
I would say I'm still a dog person through and through, but some cats do melt my heart a little bit and make me sort of go to the dark side.
Amy, the 1-year-old rescued cat, has had leech therapy for a week.
The leeches did bring the blood supply back to most of the foot, except for the skin. The skin died.
In order to save her leg, her only hope is a skin graft. Today, Noel has come to his soft tissue and cancer centre with Amy to see senior surgeon Laurent.
I think we're in really good shape now to get some skin onto the top of this pod.
The newly grown red tissue on the paw is like an underlay for new skin to be grafted onto.
What we're going to do is take some skin from the chest, where we have skin in excess, and transpose it to the foot.
Laurent cuts a paper template to match the area of missing skin. He uses this to cut the shape out of the chest and places it onto a roll of bandage to prepare it for grafting.
We need to get rid of all the fat. We want this graft to be as thin as possible. The vessels are going to grow from here, and we'll try to reach this.
Laurent tacks the skin graft to the tissue underneath.
If it's well tacked like this, we can hope that the vessels will just reach the graft in time before it dies. It's all exciting to just get the skin on there. It's all rewarding. If it goes well in the end, it pays off later on.
The next 72 hours are critical for Amy. If the skin graft fails, she could still lose her leg. Piggy, the Staffy cross, is having a series of scans and tests on her knees and spine. Owners Heather and Amy are waiting anxiously for Piggy's results.
Stop scratching.
I've just had the imaging through for Piggy. X-ray picture, CT, and it's not good. All right, so sorry girls, but I had to get all of the images because I wanted to give you a complete picture. Please. I've purposely kept her asleep so that we can make some decisions together. The situation is very difficult. So I knew she would have arthritis of her knees, which she does. I also knew she would have some disc problems in her back, which she does. What I didn't know is that there's a third problem. And there's no easy way to say this. It's cancer. I'm sorry. We'll give you a few minutes. We'll give you a few minutes. Do you want me to leave for a few minutes and just give you a few minutes? I'm so sorry. This is a CT scan of her pelvis, and that's the tumor there. And it's eating away all of that side of the pelvis, all that moth-eaten stuff is tumor. We could cope if it was arthritis or if it was a problem in her lower back, or I could do some surgery perhaps that would help her.
You can't do anything but that I cancer.
We have to face the facts that this is bone cancer, and the only way forward is either we give her drug therapy for a while to try and kill pain, or we cut off half her pelvis, which I'm definitely not recommending. It's possible, but it's not right for her, you know. Let me give you a few minutes.
Amy calls her dad, Chris, to tell him the news.
She's got cancer. Can I pass you over to Noel so that you know what's going on properly?
Hello, Chris. I'm so sorry, Chris. This is just a really bad situation.
I know she does know we love her. We wouldn't have brought her here if we didn't love her, would we? She knows we love her.
Chris, I'm just going to put you on speaker because I want us to make a decision together.
We didn't even know anything about cancer, so we are really shocked, but at the same time it sounds like she's in such a lot of pain, and I don't want to bring her home like that.
I agree. I mean, if she is sedated now and she's asleep,
yeah. I wish I was with you.
I think prolonging anything is for our benefit.
Yeah, I agree, and I don't want that.
Right now, she's completely oblivious to everything.
She always has been.
She's probably in such a less amount of pain than she's been in for a long time, if the truth be known.
I've always tried really hard to be the advocate for the animal. When you have multiple problems and then you get hit with cancer as well, it's morally the right thing to do. To just allow life to pass away peacefully.
Now, Amy, won't she?
Amy, you ready?
Yeah.
Okay.
Yeah.
I'm so sorry.
Baby, we love you.
We'll give you a few minutes. I'm so sorry.
Rested forever. Oh, we love you.
Rex, the Staffy puppy, has been having daily physiotherapy and hydrotherapy to strengthen the soft tissue supporting his elbow. Despite initial reservations, Rex has come round to the idea of swimming.
We are doing it every day with him just because he's a puppy, he's got a lot of energy, so we want to get some of that energy out so he doesn't misbehave too much in kennels.
It's Saturday afternoon. Alternate and Nicole have finally come to take Rex home.
Thank you.
It's already unlocked, sorry.
Thank you.
You okay?
Yeah.
Now, you all set? So your bundle of absolutely bubbling energy is ready to go. The elbow's fitting together quite well, but it's still loose because the tissue around it needs to build up. He's not under any circumstances allowed off the lead.
Off lead? No.
No, but he can have as much walking as you can give him on lead. Right, I'll go and get him. Now, there we are. Let's go to reception and we can pop him down on the ground. Okay, come on, big guy. So as you can see, you can take him. Go ahead and take him. All right, walk him up and down there for me as quick as you can. Walk swiftly, and then he'll go. As you can see, he's raring to go. He's absolutely raring to go.
He's happy, yes.
Yeah, he's very happy.
Where are you going back? You're going to go back? Gorgeous, gorgeous.
All right, I'm going to bid you farewell.
Thank you
Look
very
after
much.
yourself. Well done. It's great to see you. Look after yourself. All right, bye.
Bye-bye.
Good luck. You might need it.
Yep.
I feel really excited because he's gonna come back home. Everything else is gonna be fine again. Like everything's gonna be normal without any empty spot for like Rex.
It's funny how you can get attached to pets. It's lovely. Best thing I ever done is have a dog. Yes? Apart you, of course.
2.5 months later in Leigh-on-Sea, Rex is enjoying long walks with Alternate and Nicole and getting stronger every day.
He's good. He's really good, really powerful. He wants to walk, he wants to run. He wants to do everything he couldn't do before.
You get greeted with like lots of hugs and like lots of love and stuff.
He loves you, yes. He loves you more than me.
The skin on Amy's paw is growing back well. Her frame has been removed and she's been having regular physio and hydrotherapy to improve the strength in her leg.
Look at that, playing with both front feet with the ball. At the end of a very long journey, hopefully that faith and belief that Barbara had will be reflected in a life of happiness on 4 legs.
It's been a long wait for Barbara, but finally the day has arrived for her to take her home.
Can you pop Amy in this and bring her down?
I'm getting Amy home.
They may have spoken every day, but this is the first time Noel has met Barbara.
You're like the nicest woman in the world.
You're the loveliest man in the world.
You are like the nicest woman in the world.
What's that?
Almost nobody would do what you've done for this cat. Genuinely, almost nobody would do it.
I'm just so grateful for everything you've done for us.
It's my pleasure. Come and see me in the room. Right, everybody, this is the nicest woman in the world. This is my team.
Amy's team.
That's Freya, Leo, Emma, Clement, Stephanie.
Hello. Oh, thank you all so much.
And here is the star of the show.
Oh, darling. I'm frightened to touch her now. Oh. To me, they've worked a miracle. And she's so young. She just, you know, I just want to give her the best chance in life. And hopefully now we can grow old together. When she first came back, it took a day or so for her to settle in with the other 5 cats. Of course, I was a bit concerned when she came out. She's just going to disappear into the bushes or across the road or whatever. But she's been really sort of homely. She just nosed around and wanted to have a look around the garden and in the bushes and what have you. She gets on the roofs of all the outbuildings and everything, and nothing stops her. She's just got quite an amazing spirit for such a little girl. It's been a long journey for her, and some people would say, you know, why would you do it? But, I mean, to my mind, there's no price that you can put on love. And if you get a good result at the end of it, as we have, fortunately, then I'd do it all again in a heartbeat.